sort of this discussion around perhaps a gateway drug like, alcohol or marijuana. And the data are really mixed about that, especially now with the opioids, because so many people were started on opioids by a doctor, prescribed, that often we don't necessarily find that there's other substance use going along with that. Yes, sir.
Is there any effort on the drug industry to research? I know now with the new administration there is not going to be much money into going into finding research for replacement medication, but generally the question is there an effort to find medication replacement that would not lead toward this type of addiction, possibly toward it?
So that's a great question. So there have been lawsuits against pharmaceutical companies because of what I was talking about, the earlier marketing about the opioids not being addictive, and they've settled or lost those lawsuits. And so there are some programs that are educational programs aimed at doctors that are funded by the pharmaceutical companies sort of as a tax, similar to the way that tobacco was taxed, to educate doctors about the risks of prescribing opioids. However, sort of on a separate level, there's a lot of work happening, coming down the pipeline of new opiate medications that are have what we call sort of deterrent for abusing. So, for example, when I talked about buprenorphine, and the trade name is Suboxone, Zubsolv, Phenterval, it's actually buprenorphine, which is an opiate, which is combined with naloxone, which blocks the opiates. So it seems weird that you have an opiate and something that blocks the opiate in the same pill. But the reason why that works is because if people take the medication as prescribed, they only absorb the opiate. They don't absorb the thing that blocks it. However, if they decide to crush up and inject it, then the blocker gets absorbed and immediately they go into opiate withdrawal. So that's a very unique pill combination, which has these two active ingredients inside of it. And there's more work that's happening now with pharmaceutical companies to develop things like this, because basically what it is if you use the medication as prescribed, it'll work, but then if you try and misuse it in some way, it won't work that way. And so that's one example, and there are other examples where the actual pills themselves can't be crushed, can't be melted, can't be, like all of these other ways to use the substance that in which it's not intended. And so there is work by pharmaceutical companies to sort of develop these so that the people are less likely to misuse them. And as you can imagine, if they can go to a doctor and they can say, I have a pill for you that your patient is not going to be able to abuse, that doctor is going to be like, oh, that's the one that I'm going to prescribe then as compared to the other ones. So there is a lot of incentives from the pharmaceutical companies to create these things that are much less likely to be abused.